I usually have a piece of toast.
You're talking in the morning? Or?
In the morning, a piece of toast or an English muffin.
Right.
And then I smoke a joint. And then that way it dries up my mouth. So that way I can go brush my teeth. But actually, when I'm out of cannabis, I go down by the third day. The twitching is uncontrollable.
Sure.
My left eye, I always get a terrible pain in my eye. My left arm jumps uncontrollably.
Right.
I have difficulty trying to control my kidneys.
Let me introduce myself. I'm Dr. Denis Petro. I'm a neurologist, and I'm happy today to visit with a wonderful person named Cathy Jordan.
Mm-hmm.
And it's remarkable for me to see someone who has survived 21 years.
25. I was diagnosed
25.
January 1986.
I stand corrected. A quarter century with the diagnosis of what we call motor neuron disease. You've been seen by some highly respected neurologist professionals. There's no question about the diagnosis.
Mm-hmm.
We can actually see some of the findings of the disorder just on looking at you. Twitching of muscles in the face, twitching of muscles in the arms, obviously some muscle loss. Could I ask you to touch my finger with your finger?
Won't happen.
Can't happen. Okay. In other words, there's what we would, in neurology, we would ask, do something called finger to nose. Can you do the finger to your nose?
Sometimes.
Sometimes. Okay.
I'm not. After I'm medicated, I probably do it.
Right. And the obvious hallmark of the condition are these muscle twitches, or what we call in neurology fasciculations. And you can see them. I'm not so sure they can appear on any video, but it's pretty obvious intuitively that there's what we would call gross muscle fasciculations in the arms, and also obviously in the legs. But so you have all the hallmarks of motor neuron disease. Mm-hmm. You've had it for a quarter century. And you are now in a position where you have used cannabis to treat your symptoms. Mm-hmm. You mentioned to me that the cannabis works in terms of the production of saliva, something we call saliuria, improves your swallowing in taking
and relaxes
food,
my throat muscles,
and helps your throat muscles. Obviously, in the condition where there's these muscle fasciculations, you state that it improves the fasciculations. And also bladder control, anxiety, or lack of it, in terms of the response to the therapy, sleeping at night. These are all things I've heard from patients like you over the years. Now, the interesting thing is my involvement with cannabis began with patients with multiple sclerosis. Now, that's a totally different disease, but it manifests many of the same symptoms that you're talking about. Primarily, the muscle spasms or spasticity as seen in MS was the reason why I got into this situation, because I found that cannabis made it better. So 31 years ago, I did a clinical trial which demonstrated that what you're saying is true. So now we're at a position where we have cannabis, we know it works, yet in the state of Florida, you can't legally use it. Why?
Because politicians are trying to be doctors, and they're not.
Right.
I just went out and smoked about a half of my cannabis, a joint.
So how much have you, in terms of cannabis, how much have you taken?
About a half a joint.
Half. Okay, and how much in a normal, is that a normal amount for you?
If I'm having a good day, I may not smoke again until after lunch.
So, and that's another important thing. So you know, in fact, I've heard this hundreds of times in MS and other conditions, if you're having a good day, in other words, you will know in any given day or any given time, you say, well, I think I kind of need to try it again because I'm not having that great a day, right?
Yeah, yeah. Whether it be that I'm depressed, or whether it be I'm busy,
Right.
because I am active in trying to get patients to be active for themselves.
Sure.
And I am trying to restart Blood and Can with Jody, and I am fundraising, and
Sure.
so I'm trying to get a lot of things started.
Get a lot of miles
Yes.
out of this. Now, I noticed, first of all, you are, as they say, loose as a goose.
Yes.
Can you describe what that is all about in terms of?
I have no tremors.
Right.
I don't feel the, well, I always have a twitch every once in a while. But my throat is more relaxed. My body is more relaxed.
Right.
And my legs, my feet have gone down immediately.
Sure.
My shoes come off in the bathroom. That's why we were laughing, because my feet went down so much that my shoes come off. So it does, once I eat and I medicate, it just changes my whole body.
So you're relaxed from the point of view of the muscles, and you can see it when I just examine you. And earlier, remember, you were jumping all over everything, but you see, this is essentially a normal kind of tendon reflex. It's not associated with the hypertonicity that you had before. What about strength? Do you think you're stronger, or?
Yeah, I always think I'm stronger, but we'll see.
Now, your baseline is not great, so you have to be the judge, and you're trying to do the finger-to-nose thing.
Yep.
You have to do more with the nose moving down than the
and
finger
I have
up.
to do more
Right.
on also my shoulders.
Sure.
My therapist says I cheat.
Well, again, I think the observer has to really be aware that over years, you actually lose muscle mass. So you're not starting at 100%. In other words, if you would take anything, you're not going to get back to 100%. You're going to get back to at least better than before. And hopefully that's good enough to maintain, rather than to say, well, I can now do many, many functions. You're trying to avoid problems rather than cure yourself.
Yes, but also, even if it didn't make me feel stronger, the fact that it just relaxes me this much,
Sure.
it takes this much pressure off on my body.
Right. That's another interesting observation. You take your mind. What are you saying about what it does to your mind or your thinking?
Well, I've always said you have to have ALS to understand this.
Right.
But you've seen enough with MS.
Oh, sure.
But all right, the thing that in the first 3 years, I went from brushing my hair on Monday, and on Saturday, I had to lay my head on
Right. No, that's part of the disease in terms of the evolution. But it's not to say that...
But I went from that to actually, when I first used cannabis, that's why I say a higher grade. When I first used it, I went from being not weak to being able to walk across my yard and actually put a sweater on myself, which I thought was amazing. I actually put my arm in a sweater sleeve, which I had lost the ability.
And that's a hard thing to do as far as manipulation.
Yeah. But that's when I first realized I'm not dying with this disease anymore.
Right.
Whether anyone else believed me, I didn't care.
But again, someone who's from the outside would say, well, you've done the cannabis, but you're not cured.
There is no way to cure ALS.
That's
right.
right. There's
now.
nothing that actually will do the cure part. But you earlier had mentioned issues about antioxidant effect and neuroprotection and all of that. Now, I can quote the clinical studies that say that's important, but it still doesn't say that it is a cure for the disease. And I think, again, some people would say from the outside, they say, well, but it's not a cure. And I sort of laugh at that because, like in MS or even in Parkinson's, as we talked, we're hoping to sustain. We're not dealing with these conditions and say, we're going to get you back to where you were 25 years ago. And from the doctor's point of view, we're looking for small miracles. We're not looking at the idea of cure.